And when you freeze the embryo for PGTA testing and you unfreeze them, it also doesn't impact the quality and the overall outcome of the embryo implantation, right?
It shouldn't. Now, there are about 5 to 10% of cases where embryos do not survive either the freezing or thawing process. The hard part is you don't know if an embryo survives the freezing process until it's thawed, because right, you can't tell. So if embryos don't survive the thaw, it may not necessarily be that it didn't survive the thawing process. It could have also have been something during the freezing process. It could be something internal with the embryo where it didn't take up enough cryoprotectant in the time that it was given, or it didn't, the water didn't get removed from the cells properly, so ice crystals formed which damaged the embryo. But it's hard to say. So there are situations where embryos can be damaged, and there are situations where the freezing and thawing processes can affect the embryo's quality, but I would say that it's not very common. It happens in less than 10% of cases.
I see. And we talked about, euploid embryo and euploid embryo. So at this point, if an embryo is not, considered, let's say if the embryo is, chances of success is very less, do you inform the patient and let them decide, or is it the decision made by the doctor and the embryologist?
Most of the time, and again, I'm just speaking from the United States, I can't speak from all countries, but I know in the United States, most people will sign a consent form prior to IVF, and it will say something along the lines of, I want to do PGT with my embryos, and I understand that abnormal embryos can't be transferred. So if my embryos are abnormal, I consent to have them discarded or donated to research or whatever the clinic might offer. And that's because a lot of clinics do not transfer abnormal embryos. It's against their policy. And it's mainly just because it's sort of an ethical dilemma for a lot of doctors, because it can result in pregnancy complications, miscarriage, birth defects. And so doctors they struggle with transferring these embryos, knowing that they could potentially be transferring an embryo that could cause some complications later on.
Right. And when we talk about donating embryos, frozen embryos for research, what do they do with the research? Do they look for genetic defects or?
It's a great question. When someone donates embryos to research, most of the time those embryos are used for training. So if there's a new embryologist who comes in who needs to train on the procedures, then those embryos will be used. They're ultimately discarded. They're not, they're not transferred to anyone else. They're just used in the lab for a day or so, and then they're discarded. Another option could be a research project. So some labs will do like a yearly research project, and they'll submit their findings to, in the United States, it's called ASRM, and we have a big conference every year where we present our research. And so some of the embryos would be used for that. So for example, in one of the labs that I worked in, we were trying to discover a faster way to thaw embryos. And to do so, we had to thaw a lot of embryos to get our research group. So they were all embryos that were in research, and we were able to thaw about 100 of them. So yeah, those are normally what they're used for, training or for research projects. But again, they're always discarded. They're never transferred to anyone else, and everything should be documented well.
Yes. Is it possible, though, to, let's say, just take a frozen embryo and maybe make use of it somewhere? Somebody very unethical can make a baby. Is it even possible?
Do you mean donating an embryo to someone else?
Not donating, stealing, let's say. Is that even?
Oh, I mean, I hope that never happens. It's not anything that I've ever seen. So whenever embryos are frozen, they're each frozen with their own labeled device. So you should always know what embryo belongs to what person. And the lab is guarded. It's part of the policy or the guidelines here to have labs locked so people can't get in unless they're a staff member. So everything should be guarded, so that shouldn't happen.
Right.
And I've never had it happen, and I hope I never do.
Yeah. When you donate an embryo, can a patient agree to donate an embryo to another patient? Is that even ethical?
Yes, in the United States, we actually have multiple programs or in agencies that you can do that through. So you can anonymously donate your embryo to another couple, or you can do a known donation. So say you have extra embryos that are frozen and someone you know is struggling to build their family, and you talk with them and you would like to donate your embryos to them. That's definitely possible. There are guidelines and rules that need to be followed, and it is a lengthy process, but it's absolutely something that can be done. And then, like I said, there are third-party agencies as well, and you can donate embryos to them as well.
Oh, and then the third party will maybe use it according to what suits them more. Maybe.
Right. It's almost like an egg bank, a donor egg bank or a donor sperm bank, but with embryos. So they would put the embryo into their database, and then a recipient or a potential recipient would choose the embryo based on the information that's provided in that database. So maybe some information about the egg source, the sperm source, if the embryo has any siblings, and it's a process, but it's definitely something that can be done.
It's fascinating and very sci-fi like.
Yeah. It really is amazing, though, how many ways we can help people build their families. It's not what we would call conventional, but it absolutely works, and it's helped so many people.
It has, hasn't it? Well, thank you for everything that you do to make.
Oh, thank you.
Yeah, to make dreams a reality for so many families. Well, thank you for your time this session also. And I look forward to talking with you. Well, then our session has ended, and I cannot thank you enough, Jessica, for agreeing to do this. And I guarantee you, so many people are going to learn from this. We are going to segment this into smaller videos so that the videos that you sent and the interview goes hand in hand and it reaches more people. May God continue to use you mightily for his purpose. And from Subhat Health Tech, we wish you the very best in everything that you do.
Oh, thank you, Jamie. I really appreciate that.
Right. I will speak to you one day soon.
Okay, that sounds wonderful. Have a great day.
Yes, thank you. And you have a very good Independence Day week holiday.
Thank you. All right. Take care.
Yes.
Okay. Bye.
Bye.